Yes, good morning to all. In Yes, good morning to all. In today's class, I'm going to start the new chapter that is Unit 3 Pharmacology of Drugs Acting on CNS. Okay, so in this, the first topic is general anesthetics. Okay, so here in this general anesthetics, I'm going to explain about the what is the definition of the general anesthetics and what is the stages and depth of anesthesia and what is the differences between the general anesthetics and local anesthetics and what is the ideal properties of the general anesthetics and what is the classification of the general anesthetics and mechanism of action of general anesthetics and what are the general or individual characteristics of the general anesthetics and complications of general anesthesia. Okay, so first thing is what is the definition of the general anesthetics? So general anesthetics are the drugs. Okay, so these drugs which causes the reversible loss of all sensations and consciousness. Okay, so general anesthetics means these are the drugs. Okay, so these drugs are which cause a reversible loss of all sensation and consciousness. Okay, that is called as general anesthetics. Okay, and this general anesthetics is causes the all sensation, especially it is used to relieve the pain and it is induces the sleep and it is induces the unconsciousness and it is induces the amnesia, means loss of memory during the surgery time only. Okay, and it may causes the immobility also. Okay, and it causes a muscle relaxation. Okay, and abolition of the somatic and autonomic reflexes, means it is inhibit that this general anesthetics drugs are inhibit the somatic and autonomic reflexes. Okay, so general anesthetics is nothing but these are the drugs. Okay, these drugs which cause a reversible loss of all sensations. Okay, all body sensation and it cause the loss of what consciousness also. Okay, and loss of consciousness is occurs and these general anesthetics are used to relieve the pain during the surgery and it is induces the sleep and it induces the amnesia and immobility, all autonomic and somatic reflexes also inhibited by general anesthetics drugs. Okay, and next thing is what are the stages and depth of anesthesia. Okay, so here there are three phases is there, that is induction phase, maintenance phase and recovery phase. Okay, so here in this induction phase, what is induction? Okay, so induction means the period of time, okay, from onset of administration of the anesthetics to development of effective surgical anesthesia in the patient. Okay, that is called as induction period. Okay, it is a time period. So in this it is period, it is start from the onset of administration of the what anesthetics drugs and to the development of effective surgical anesthesia, okay, in the patient. So that is called as induction period, and this period it depends upon the how fast effective concentration of the anesthetic drug reaches the brain. Okay, so the period of the induction period is depends upon the how fast effective concentration of the anesthetic drug it is reaches to the brain. Okay, so for example thiopental. Okay, thiopental, the route of administration of thiopental is IV route. Okay, so this thiopental drug which produces the unconsciousness within the 25 seconds. Okay, and propofol, this drug is produces the unconsciousness in 30 to 40 seconds after injection. Okay, so here the thiopental drug, it is reaches to the brain very fast. Okay, so that's why the unconsciousness is occurs within 25 seconds only. Okay, and propofol is also produces the unconsciousness within 30 to 40 seconds after the injection. It takes somewhat longer time compared to thiopental. Okay, so nothing but this propofol having This propofol drug is also reaches the brain, but it takes some more time. Okay, but thiopental, the route of administration of IV route, so thiopental after injection, then the unconsciousness is produced within the 25 seconds only. Okay, so this one is induction period. Okay, so it is a time period. This in this period, it starts from onset of administration of the anesthetic drug to the development of effective surgical anesthesia in the patient. And the period, okay, that period is depends upon the how fast effective concentration of the anesthetic drug it is reaches to the brain. Okay, so thiopental it is reaches the brain very fast compared to propofol. Okay, and second phase is what maintenance phase. Okay, and the duration of action of IV route of this general anesthetic agents is generally 5 to 10 minutes. Okay, the duration of action of the duration of general anesthesia, okay, the duration of the anesthesia is 5 to 10 minutes. Okay, so after that particular period, the person might be get a conscious. Okay, so the person may feel the pain in the response to stimuli. Okay, so that time the surgeon is unable to perform the surgery also. Okay, the person is unable to do that surgical procedure. Okay, so to avoid these events, okay, here we have to prolong the anesthesia. Okay, here we have to prolong the anesthesia means we have to give the again external anesthetics drugs during the surgery time. Okay, then what will happen, the duration of that surgery is increases because of again here, again we are giving the here general anesthetics drugs. Okay, so that is called as maintenance. Okay, so actually the duration of action of IV injection of the general anesthetic drugs is only 5 to 10 minutes, but after that the person may get what consciousness, and the person may feel like what the person may respond to stimuli also. So in that time, the surgeon is unable to do the surgical procedures. Okay, so that's why here we need to prolong the what anesthesia for the required duration. Okay, so again we have to give the what anesthetic medications. Okay, during the surgery procedure also, so that is called as maintenance. Okay, so after administering the anesthetic drugs, the vital signs and the patient response to the stimuli are monitored continuously. Okay, to balance the amount of the drug inhaled or infused with the depth of the anesthesia. It is called as maintenance. So during the maintenance period, here we need to observe the person, nothing but patient vital signs, and the patient response to stimuli is also monitored during this phase. In case the person may response to stimuli means here we need to give the what general anesthetic drugs. Okay, purpose of giving the anesthetic drugs is what during this phase, to prolong the anesthesia for required duration. Okay, for the required duration, and that anesthesia is must be maintained. Okay, and third phase is what, recovery phase. So what is that recovery phase? The time from the discontinuation of the administration of the anesthesia until consciousness and protective physiological reflexes are regained. Okay, so during this recovery phase, the person may get the what consciousness, and the person may respond to stimuli also, means after surgery. Okay, so it is a time period. Okay, this period starts from the discontinuation of administration of the anesthesia, okay, until consciousness. Okay, so means after the surgery the person may get the consciousness. Okay, and protective physiological reflexes is also regained, all autonomic and somatic reflexes it will be regained. And the recovery period is depends upon the how fast the anesthetic drug diffuses from the brain. Okay, so the recovery period is depends upon the how fast the anesthetic drug is diffuses from the brain. Okay, so these are the three phases of the anesthesia. So what is the three phases? Induction phase, maintenance phase, and recovery phase. Okay, And next, what is the stages of general anesthesia? So here the stage one. Okay, so the stage one, the name of that stage one is what? The stage of analgesia. Okay, so it is starts from the beginning of the anesthetic inhalation and it is last up to the loss of consciousness. Okay, and it is beginning of the it starts from the beginning of the administration of anesthetic inhalation and it is last up to loss of consciousness. Okay, and this pain is progressively abolished during the stage and means the pain it will be relieved during this stage and the patient remains conscious during the stage one. The patient remains conscious and the patient can hear and see the things. Okay, and it feels a dream and the patient feels a dream like stage during the stage one and the reflexes and respiration is also normal and this stage is difficult to maintain. Okay, by use in this stage only the short surgical procedures can be used. Okay, during this stage. Okay, so a short surgical operations it can be done in the stage one phase. Okay, stage one, that is stage of analgesia. So during this analgesia phase the person may relieve the pain. Okay, pain is progressively abolished during this stage but the person can hear and see the things and person feels a dream like stage. Okay, and here in the stage one all reflexes and respiration should be normal. Okay, and what is the stage 2? Okay, so stage 2 is a stage of delirium and excitement. Okay, the name of the stage 2. Okay, so here this period starts from the loss of consciousness. Okay, so in stage 1, so in stage one, what it is a beginning of the inhalation anesthetics to the loss of consciousness. So here in stage two, it stands from the loss of consciousness to the beginning of the automatic breathing. Okay, automatic breathing is nothing but normal regulatory, normal regulation of the respiration. Okay, so it starts from the loss of consciousness to the beginning of the normal regular breathing and in this phase the eyelash reflex is disappears. Okay, and the person may get very excitement, means the patient may shout and struggle and the patient hold his breath also in some of the cases. Okay, and the muscle tone is also increases in stage 2 and jaws are tightly closed in stage 2 and the breathing is jerky is nothing but jerking respiration and vomiting is also occurs and involuntary micturition is also occurs and involuntary defecation is also occurs in some of the conditions and there is no stimulus or operating procedures carried out during this stage. Okay, and because of why operative stage is in minor operative procedures can be carried out during this stage but not major operative procedures are not carried out during this stage. Okay, and the potentially dangerous responses can also occur during this stage. Okay, so what is that? Vomiting, involuntary micturition and vomiting is occurs and laryngospasm. Laryngospasm means the spasm of vocal cords. Okay, and the person is unable to breathe during this stage. Okay, and uncontrolled movement is also occurs. Okay, so this stage is not found with modern anesthesia. Okay, nowadays we can't found this stage 2. Okay, why? Because the stage 2 is not found with the modern anesthesia. So modern anesthesia is nothing but pre-anesthetic medication. Okay, so what is meant by pre-anesthetic medication? Pre-anesthetic medication means what? So pre-anesthetic medication means these are the drugs. Okay, so these drugs can be used before the administration of the anesthetic agents. Okay, these are the drugs. These drugs are administration before the administration of the anesthetic agents to make the anesthesia is safer. Okay, and it is more agreeable to the patient also. And what is the aim of this pre-anesthetic medication? Okay, these drugs are used to relieve the what? Anxiety and amnesia. Amnesia means it's the loss of memory for pre and post operative events. Okay, and this pre-anesthetic medication is used to relieve the analgesia, means it is used to relieve the pain, and this pre-anesthetic medication is used to decreases the all gland secretions. Okay, and these pre-anesthetic medications are used for the what it decreases the episodes of vomiting. Okay, so this pre-anesthetic medication having the what? Antiemetic effects, and these pre-anesthetic medications are used to decreases the acidity, and it decreases the volume of gastric juices also. Okay, so these are the pre-anesthetic medications. And what is the examples of this pre-anesthetic medication? So here there is a 6 categories of 6 pre-anesthetic medications is there. So that is 6 A's: anxiolytics, amnesia, anticholinergics, antacids, antiemetics, and analgesia drugs. So what is the examples of anxiolytics? So anxiolytics examples is what? Sedatives. Okay, so sedatives example is diazepam and lorazepam, and midazolam and promethazine. Okay, these are the examples. This example which is comes under the anxiolytics. Okay, and these drugs are used as a pre-anesthetic medication. And what is a pre-anesthetic medication? Pre-anesthetic medication means these are the drugs. These drugs can be used before the administration of the anesthetic agents. What is the purpose of giving this pre-anesthetic medication? To make the anesthesia is safer and it is more agreeable to the patient. And these pre-anesthetic medications are used to relieve the pain, and it decreases secretion and decreases the vomiting, and it decreases the defecation also, involuntary defecation also, and it decreases the acidity and decreases the volume of gastric juices. And these drugs are used to relieve the anxiety also. Okay, and these are the 6 A's pre-anesthetic medication: anxiolytics, amnesia, anticholinergics. Anticholinergic example atropine, and as examples H2 blockers, that is ranitidine and famotidine. And antiemetics example metoclopramide and domperidone. And analgesia example is opioids. Example is morphine and it conjugates. Okay, and these are the pre-anesthetic medication. And next one is stage 4. Okay, sorry, stage 3. So stage 3 is the stage of surgical anesthesia. Okay, so it is extends from the onset of the spontaneous respiration. So it is extends from the onset of spontaneous respiration to the respiratory paralysis. Okay, so during this period is known as the stage of surgical anesthesia. So this anesthesia, this stage 3 is divided to 4 planes. So in first plane 1, here the roving eyeballs is present, means what? There is a movement of eyeball. Okay, and this plane is ends when the eyes becomes are fixed. Okay, in plane one, what will happen? There is a movement of eyeball is there. There is a slight movement is present in that eyeball. And in plane 2, there is a loss of corneal reflexes and there is a loss of laryngeal reflexes in plane 2. And plane 3, the pupils are starts dilated and light reflex is also lost. Okay, in plane 3, what will happen? The pupils are starts the dilating. Okay, and light reflex is also lost. And this is a very desired phase of the surgery. Okay, so this is a desired phase of the surgery when muscle relaxants are were not used this plane 3 stage. Okay, so the best time for the doing the surgery is what? In stage 3. In stage 3 again, third phase. Okay, so this stage 3 again divided to 4 planes. In that the third plane is very suitable period uh, for the performance of what? Surgical procedure. Okay, and plane 4 is what? Intercostal paralysis. Okay, so intercostal paralysis means what? The intercostal muscles means what? The muscles which are present in ribs. okay, in between the ribs. So the muscles, it will be what relaxant is relaxation effect is occurs, the paralysis effect is occurs at the intercostal muscles. So as a result of paralysis is present at the intercostal muscles and diaphragm muscles, then is what will happen, the shallow respiration is occurs. Okay, the respiration should be becomes to decreases, the respiration rate is also decreases, and the pupil will become to the pupil dilated. Okay, the dilated pupil is also occurs in plane 4. Okay, so this one is stage 3. Stage 3 is also known as what? It is a stage of surgical anesthesia. It is extend from the onset of spontaneous respiration to the respiratory paralysis. So it is divided to 4 phases, 4 planes. In first plane, the movement of eyeball is there. In second plane, there is a loss of corneal reflexes, there is a loss of laryngeal reflexes. And in plane 4, the pupil start dilated and light reflex is lost. So this is the best time for the is a desired phase of the surgery. And plane 4, there is a paralysis occurs at the intercostal muscles and paralysis occurs at the diaphragm region. So slowly the respiration rate is also decreases. Okay, this one is stage 4. And next one is stage stage 3. This one is stage of surgical anesthesia. Next is stage 4, that is medullary or respiratory paralysis. Okay, so during this stage, it starts from cessation of breathing, means there is a stoppage of breathing is occurs. So as a result of cessation of breathing, there is a failure of circulation is also occurs, and it may lead to death is also occurs. Okay, in case any other external overdose of general anesthesia. Okay, overdose of general anesthetic drugs. Okay, improper dose of general anesthetic drugs, then what will happen, there is a the stage 4 thing is happens. Okay, total respiratory paralysis also occurs. Okay, so that is cessation of breathing, total complete stoppage of breathing is occurs, then the failure of circulation is also occurs, and finally death is also occurs. And the pupils are starts dilated, means the pupils are widely dilated during this stage 4, and the muscles are totally flabby. Flabby is nothing but what, the muscle weakness. Okay, and pulse is imperceptible. Imperceptible means what, unnoticeable, means what, there is no recognition of the pulse. Okay, the pulse rate is also decreases in stage 4, and bp is also reduces, the bp is also decreases in stage 4. Okay, so stage 4 is what, medullary or respiratory paralysis. So stage 1 is what, is the stage of analgesia, means in this phase there is only reduces the pain, but the person may remains consciousness, and the person can hear and see and feels a dream like state. But in stage 2, the person may get excitement, and there is a some potentially dangerous responses is also occurs, like vomiting and spasm and uncontrolled movement is occurs. So to avoid this vomiting and laryngospasm and uncontrolled movements, we can use the pre-anesthetic medication. So this pre-anesthetic medication, it can be used before the administration of the anesthetic agents to make the anesthesia safer and more agreeable to the patient. Okay, so these pre-anesthetic medications are reduces the vomiting and reduces the defecation, reduces the excretions, and reduces the acidity and gastric juices, and it relieves the anxiety. Okay, and reduces the pain also. These are the examples of pre-anesthetic medication. And stage 3, it is the stage of surgical anesthesia. So this stage 3 is suitable for the surgery. Okay, especially at the plane 3 phase. Okay, plane 3. Okay, and this one is phase 4. Okay, in this the person pulses decreases, bp is also decreases, and muscles are totally becomes to flabby, muscle weaknesses occurs. In some of the cases death is also occurs. Okay, this one is stages of what, general anesthesia. Then what is the differences between general and local anesthetics? Okay, so here description, and what is the site of action of general anesthetics. the central nervous system. And what are the site of action of local anesthetics, that is peripheral nerves? Means the site of action of general anesthetics and local anesthetics both are different. So general anesthetic site of action is only central nervous system. Local anesthetic site of action is peripheral nerves. And the area of the body involved is whole body. So general anesthetics are involve the whole body, but local anesthetics are only restricted area is only involved for that local anesthesia. Okay, and in general anesthesia, the total consciousness is lost. Okay, but in local anesthetics, the consciousness is unaltered. Okay, and by using general anesthetics we can perform the major surgeries. Okay, and major surgeries is can't be used by using the local anesthetics, and minor surgeries can't be used by using general anesthetics. Minor surgeries can be preferred by using the local anesthetics drugs. And general anesthetics are very risky and very dangerous potential reactions is also occurs, but local anesthetics are very safer. Okay, so these are the differences between general anesthetics and local anesthetics. Next, properties of the ideal anesthetics. Okay, so what is the ideal properties of general anesthetic agents? So from the patient point of view, okay, from the patient point of view, this general anesthetic drugs should be pleasant and non-irritating and should not cause the nausea and should not cause the vomiting also. Okay, and the induction and recovery should be fast with no after effects. Okay, so the induction and recovery should be fast without any other side effects. And from the surgeon point of view, the anesthetic drug should be provide adequate analgesia. Okay, analgesia means what? The person is unable to feel the pain. Okay, the patient is unable to feel the pain, that is called as analgesia. And immobility and muscle relaxation. Okay, from the surgeon point of view, anesthetic should be provide adequate analgesia and immobility and muscle relaxation, and it should be non-inflammable. Okay, what is that? It should be non-inflammable and non-explosive, so that catheters may be used. What is meant by catheter? Okay, so catheter means it is a one kind of instrument. So this instrument is used to stop the bleeding during the surgery. Okay, so by using this catheter instrument, the surgeon the surgeon may burn the some parts of what any muscle or tissue region. Okay, by using this cartridge instrument, the surgeon may burn the what the cutting edges of the muscles or cutting edges of the tissues. Okay, what is the purpose of burning here? To stop the flow of blood. Okay, so uh, that is known as cautery. Okay, and from the surgeon point of view, anesthetic must be what? Non-inflammable and non-explosible, so that only the surgeon can be use the cauteries. Okay, and from the anesthesia doctor. Okay, from the anesthesian. Okay, from the anesthesian point of view, this general anesthetic should be administered, should be what? Easy. Okay, the general anesthetic drug administration should be easy, and it is controllable, and it is versatile, and the margin of the safety should be wide. Okay, and there is a no fall in the BP also. Okay, and heart, liver and other organs should not be affected. Heart, liver and the patient heart or liver and other organs should not be affected, and that general anesthetic should be potent, so that low concentration is needed and oxygenation of the patient is does not suffer. Okay, these are the ideal properties of anesthetics from the patient point of view, from the surgeon point of view, for anesthesian point of view. For the patient point of view, it is a pleasant and non-irritating, so that the induction and recovery should be fast without any other side effects. For the surgeon point of view, it should be non-inflammable and non-exposable so that cartridge may be used. And for anesthesia point of view, it is admission should be easy and should be controllable, and margin of safety should be wide. There is no fall in the BP, and there is no heart and liver other organs that should not be affected. Okay, and this general anesthetic should be potent so that low concentration is needed. Okay, and oxygenation of the patient is does not suffer. Okay, these are the ideal properties of the general anesthetics. Okay, and next thing is, what is the classification of the general anesthetics? So general anesthetics are divided to two types, that is inhalation anesthetics and intravenous anesthetics. So inhalation anesthetics are divided to two types, that is gases and liquid volatile liquids. Okay, so gases examples is nitrous oxide. Volatile liquids examples is ether, halothane, enfluorine, isoflurane, and disflurane, and sevoflurane. Okay, and intravenous drugs examples is inducing agents. Inducing agents examples is thiopentone sodium and propofol and methohexatone sodium and etomidate. Okay, these are the inducing agents. Okay, intravenous inducing agents. Next is slow acting drugs, that is benzodiazepines. The benzodiazepines examples diazepam, lorazepam, and etomidate and midazolam. And dissociative amnesia examples is ketamine. Okay, so this one is classification of the general anesthetics. And what is the mechanism of action of the general anesthetics? Okay, here first one is GABA A receptors. Okay, so GABA means what? Gamma aminobutyric acid. Okay, this one is inhibitory neurotransmitter. Okay, so this inhibitory neurotransmitter receptors are potentiated by what? Halothane and propofol and etomidate and enflurane, isoflurane and disflurane and sevoflurane. Okay, so here this inhalation general anesthetics drugs are, first it is binds with what? Mm, GABA A receptors. Okay, first it is binds with GABA A receptors. Then after binding with GABA A receptors, so what is the nature of the GABA A receptors? It is act like a ligand gated ion channel. Okay, it is act like a which ion channel? Ligand gated ion channel. So after this inhalation anesthetics are binds with the GABA A receptors, so then what will happen then? This one is GABA A receptor. Okay, so after binding of this like inhalation anesthetics with the GABA A receptors, uh, so GABA A receptor is act like a what? Ligand gated ion channel. So here after binding of this inhalation anesthetics, there is the opening of the ion channel. So which ion channel? There is chloride ion channel. Okay, so as a result of opening of the chloride ion channel, what will happen? There is an influx of the chloride ions. Which ions? Chloride ions. So the negative charge within the cell is increases. Okay, so that's why it will lead to what? Hyperpolarization. Hyperpolarization is occurs. Okay, so hyperpolarization is occurs within the cell. So what? Nothing but what? There is no transmission of the signals. Okay, in between the two neurons. Okay, from neuron to another neuron or neuron to muscle cells. Why? Because this inhalation anesthetics are binds with GABA A receptors. Okay, GABA A. This GABA receptor. GABA means what? Is inhibitory neurotransmitter. Okay, so after binding of this GABA A receptor, this receptor is act like a ligand gated ion channel, and after inhalation anesthetics binds with the GABA A receptors, there is an opening of the ion channel. The name of the ion channel is what? The chloride ion channel. So as a result of opening of the chloride ion channel, there is an influx of the chloride ions. So it may lead to what? Hyperpolarization is also occurs. So nothing but there is no transmission of the signal from the one neuron to another neuron or neuron to effector organs. Okay. So this one is there is no transmission of the signals from one neuron to another neuron or neuron to effector organs. Means what will happen? There is a neuromuscular transmission is decreases. Okay, so nothing but the person is unable to feel the unable to feel the pain. Okay, the person is unable to feel the pain. Why? Because there is no transmission of the signal from neuron to neuron or neuron to effector organs. Because of this, inhalation anesthetics are potentialize the actions of the GABA A receptor. It may cause us a hyperpolarization, and there is no transmission of the signals in between the two neurons or neuron to effector organs. So that's why the patient is unable to feel the pain. Okay, due to inhibition of the transmission, neurotransmission. Okay, and ketamine, this and nitrous oxide, this one is gas. Okay, and xylene. So these are the this ketamine and nitrous oxide is inhibit the NMDA receptors. Okay, what receptors? NMDA. Just wait, I will erase this thing. Okay. Mm. Ketamine, it is inhibit the what? NMDA receptors. So first, what is NMDA? What is the full form of NMDA? N-methyl D-aspartate. Note down, N-methyl D-aspartate. Okay, so this one is what the name of the receptor. So here this NMDA or NMDA receptor, it is a what kind of receptor? It is a excitatory NMDA type of glutamate receptors. It is an excitatory NMDA type of glutamate receptors. Here, the glutamate is what? It is an excitatory neurotransmitter. Okay, GABA is inhibitory neurotransmitter, and glutamate is what? Excitatory neurotransmitter. Okay, so here the glutamate is what? Glutamate after binding with the NMDA receptors, the glutamate it can show the excitatory effects, means it causes a depolarization effect. But here this ketamine and nitrous oxide drug is binds with what it is binds with NMDA receptors. See this one is NMDA receptors. Okay, N-methyl D-aspartate. Okay, it is an excitatory NMDA type of glutamate receptors. So here this ketamine drug is the ketamine drug is binds with NMDA receptors. After binding with NMDA receptors, especially it is binds with glutamate binding site. Okay, ketamine, it is binds with glutamate binding site of the NMDA receptors. After binding with NMDA receptors, it is inhibit the opening of the calcium ion channel. Inhibits the opening of which ion channel? Calcium ion channel. So as a result of inhibition of inhibit the opening of the calcium ion channel means what will happen? There is no influx of the calcium ions. Means the positive charge within the cell is decreases. So the positive charge within the cell is decreases means it is suppress the depolarization effect. Okay, so there is no propagation of the nerve impulses between the one neuron to another neuron, and there is no propagation of the nerve impulses from the neuron to effector organ also. So that's why the person is unable to feel the pain during the surgeries. Okay, and this one is a mechanism of action of ketamine and nitrous oxide. Okay, these are mainly binds with NMDA receptor, especially it is binds at the glutamate binding site of the NMDA receptors. Then it is inhibit the opening of the calcium ion channel. So that's why there is no influx of calcium ion channel, and these drugs are inhibit the depolarization effect. Okay, and next one is glycine. Okay, so here halothane and propofol and enflurane and isoflurane, disflurane, sevoflurane. So these inhalation anesthetics and halothane, these drugs are okay, both the same. Say this halothane, propofol, enflurane, isoflurane, disflurane, and sevoflurane. These are the potentiate the what potentiate the activity of glycine receptors. Okay, potentiate the activity of which receptors? Glycine. What is glycine? Glycine, it is an inhibitory neurotransmitter. Okay, so then what will happen after inhalation anesthetics binds with the glycine receptors. Okay, and then there is an influx of the what ion channel. So glycine receptors is also act like a ligand gated ion channel. So that's why there is an influx of the chloride ions. Okay, so it is stimulate the opening of the chloride ion channel. So that's why there is an influx of the chloride ions. So then the negative charge within the cell is increases. So that's why it may lead to what hyperpolarization is occurs. Okay, so as a result of hyperpolarization, then there is the inhibit the propagation of the nerve impulses from one neuron to another neuron or neuron to effector organs. So that's why the person is unable to feel the pain during the surgical procedures. Okay, so see this one is mechanism of action of general anesthetics. Okay, so here the general anesthetics are potentiator, GABA A receptors and glycine receptors. Because of this, both are what inhibitory neurotransmitters. Okay, and general anesthetics are inhibit the activity of what NMDA receptors. Because of this NMDA, it is excitatory NMDA type of glutamate receptors. Glutamate is an excitatory neurotransmitter. So this NMDA receptors is inhibited by ketamine and nitrous oxide. Okay, so this one is a mechanism of action of what general anesthetics. Okay, and so in next class we will discuss about the what general features of the individual inhalation anesthetics and intravenous anesthetics. General intravenous general anesthetics and characteristics of the individual intravenous general anesthetics. Okay, so what is the properties of the each and individual general anesthetics, and what is the advantages and what is the disadvantages of the each and individual anesthetics. Okay, both inhalation and intravenous. Okay, so today I have covered the what mechanism of general anesthetics and classification of the general anesthetics, and what is the ideal properties of the general anesthetics, and what is the stages of the general anesthesia. Okay, so these topics are covered in this session. Okay, in next section we will discuss about the general characteristics of the individual drugs. Okay, thank you.